We continue our coverage now of the tragedy at Annunciation Catholic School. You know, a lot of kids will be returning back to school next week, this after the Labor Day weekend.
And of course, this tragedy, it's going to raise a lot of questions and increase the anxiety for both children and parents as they enter and start a new school year. Dr. Sara Gonzalez, a child psychologist at Children's Minnesota, joins us now. I was talking before, we had you here last week and it was great to see you. Unfortunately, the circumstances now are very, very different, but this is a difficult conversation that parents are having with their kids. And the thing is too, it all depends on the age of the child, because the conversation you're having with, say, a teenager is going to be very different than the conversation you have with, say, a 5 or a 6-year-old child.
That's correct. The conversation needs to be age appropriate. But even before I talk about what to say, I just want to emphasize to parents and caregivers listening that being present, validating kids' feelings, and just creating space for them will mean 100% more than the perfect words, right? So sit with your kids, validate them. Feelings are just uncomfortable. There's no bad or good feeling, right? They're comfortable or uncomfortable, and there's a lot of discomfort right now. Yeah. So validate that, hear them out, and let them guide the conversation too. What do you know? What do you care to know more about? Just so that you can meet them where they're at based on their age.
AJ was talking about differences, what you're going to talk about with a teenager, with a 5-year-old. But I also think there's differences within, let's say you have 2 10-year-olds, and how you approach it with them too. Can you just give, so every case is going to be different, of course, but can you just give us some guidelines and younger, sort of middle and older children?
Yeah, I think for younger kiddos, they might not even understand, right? The concept of death, murder, shooting, right? They might not know any of those things. So just really using that as coaching if they have questions of what they're hearing, and try to explain as best as you feel as a parent that they're ready for. With those middle-aged kids that
and how would you define middle-ish age?
Yeah, 8 to 12-ish, right? To those preteen years. They might be hearing more from kids. They might have more access to media than the younger kids, have more understanding of safety in the world and when they're feeling unsafe. So really validating that. You might not feel safe right now. Mom, dad, whoever you are as an adult, for them, I don't feel safe either. And it's okay to sit with that and allow space for what that brings. For teens, just a more honest discussion of you're leaving the home a lot of times more independently. What does that mean to you? What's coming up for you in this moment, given what our community is experiencing?
I'm thinking, right now, it's short term, and we're all focused on the now, everything, the pain that we're experiencing now. But you got to imagine long term, let's say, a month from now, 2 months from now, 3 months from now, a year from now. The long-term impacts, those are going to linger as well. How do you address that?
Yeah, trauma isn't linear, right? Grief comes in waves. You might see your kid at any age crying and then playing or moving on with their friends the next. That's normal. What we want parents to understand, caregivers to understand, that if the distress, those feelings of distress, that fear of the world is sticking around, difficulties with sleeping, with eating, impact of I don't want to go to school, or regression in behaviors, aggression, those are the things to be paying attention now and in the future to be able to seek help proactively. We don't shake off trauma. We need to be proactive in seeking out help for our kids.
Doctor, we know a lot of kids, the bulk of kids, start school on Tuesday here in Minnesota. And for a lot of those kids, without even this, it was going to be an anxious time. Starting back in school, going into a new school building, going into a school building that perhaps they even already know. What advice specifically do you have for those already deeply feeling kids, or those already anxious kids, that it's now just amped up a level?
Routines. We talk about routines so often, but it's for a good reason. Routines give sense of safety and predictability. Parents sticking to their routines, if they're telling their kids, I'm going to be there by the bus stop at 3, be there by the bus stop at 3 if you can, right? So kids know what to expect and what they're looking for throughout their day. And same goes for school. That same sense of maintaining routines will give that sense of safety.
Doctor, we got about a minute left, and I'd be remiss if, it takes a village. We know that. It takes a village to heal. How is everyone doing at Children's right now? I mean, I know it's incredibly tough. I know you took some patients over there too, but how are doctors, how's the ER doing over there right now?
You know, our staff has the training. We're a level 1 trauma certified hospital, right? We have the training. Our doctors are prepared for this, but the emotional load that it takes, that always sits heavy. This was a senseless act of violence, and we're all sitting with that and rallying with the community in every way that we can show up.
There might be people now, doctor, who would like their child to perhaps see a professional, and we know, we've done this many times, there are wait lists. It can be challenging to find that right mental health professional. What do you recommend for someone who's saying, look, we need a little more help?
Yeah, I mean, there's a lot of good community providers. You can always, by word of mouth, find who those are, but the first step would be link with your pediatrician, right? At Children's Minnesota in particular, we have all our pediatricians have integrated behavioral health providers. They can be that frontline level of support to connect with kids and then link out to our community providers who we partner often with.
Doctor, thank you so much for joining us this morning. Such an important and timely conversation.
Thank you for having me.
Thank you.